care, for example, people having access to contraceptive services, people having access to malaria treatments and some of those interventions, the campaigns against malaria, bed net distribution, and indoor residual spraying have had to be postponed in many, many countries. So this is a big concern. I think the funding, if I take the example of Gavi and the Global Fund with whom we've been in contact, they have been very keen for their funding not to be disrupted. So the Global Fund particularly were keen to have countries not postponing implementation of their activities. They've even afforded or allowed a certain proportion of funding that had been targeting HIV or malaria or TB activities to be allocated to supporting the COVID-19 response. I'm not aware of the opposite, that partners who normally have been supporting other things have now put their money into COVID. I suppose it is an emergency and it will affect whatever it is that they were doing anyway. So that might be happening. But as WHO, we are very much encouraging countries to continue, while it is a challenge, at the same time as providing, as responding to the pandemic, to provide these essential services. We've developed guidelines that help them to do that safely without increasing the risk then of transmission of the virus. And we are quite certain that to some extent it'll cost more. So if you're going to space out service delivery, not have people crowded around, reschedule service delivery so that it takes place over more time, you will need more healthcare workers. We're encouraging outreach services, sometimes for immunization, so you'll need more logistics, transport, whatever. And we're hoping very much that partners will be able to support this so that the pandemic doesn't have these other impacts that you're referring to.
I wondered whether the pandemic has forced a reassessment across the continent of the importance of public health. I know something similar has been going on in Europe and even the US in terms of the access to public health suddenly has gone up the agenda. I say this in the light of the critiques, I think from the African Union, of those governments in Africa which don't meet the basic criteria in terms of the percentage of their GDP spent on public health. Do you sense that this is going to be a bit of a watershed moment? People saying that this pandemic and the spread of it across the world really means somehow governments have to reorder their priorities and push public health up the agenda.
Yeah, I certainly think so. And I certainly hope so, let me say. And I in a way pray so. And I think that unlike the last Ebola outbreak in West Africa, I mean, I sometimes have a sense that we've been here before, because that was extremely tragic. It was very difficult for the region, not only for the three countries concerned and their immediate neighboring countries, but the entire region had to, in some way or other, and the world, had to invest in being prepared to confront any other similar outbreak. I mean, our countries stayed carrying out point of entry screening for quite a while. And then following that outbreak, there was a lot of work to understand better the gaps in countries' capacities to respond to outbreaks. So in preparedness, in response capacity, and at the same time, there was a great deal of discussion about, okay, all of this is nested in having a health system that is better resourced, that is more resilient, that has the kind of infrastructure, the healthcare workers, the laboratory capacity, the procurement system, the data system that is needed, not only for responding to an outbreak, but also for providing healthcare to populations. So we coordinated the evaluation, independent evaluations, because we had, as far as outbreaks are concerned and the international health regulations, there is a voluntary self-reporting, it's compulsory, but it's self-reporting, self-assessment of capacities that countries were carried out. And then there were doubts about, if you like, the objectivity of this. And we persuaded member states to accept having external evaluations of these capacities. We've done that in all of our countries, virtually all 47, and about 40 of them have developed plans. So we did assessment of capacities and then planning how to cover your gaps. And it's been remarkable. Very little financing of the work to fill these gaps has happened, either from national budgets or from the international community that was very strongly promoting this just as we came out of the pandemic. So one observes that, okay, every time there is a very serious situation, the SARS outbreak, then we establish something called the Global Health Security Agenda. Member states are talking a lot and planning a lot to improve capacities. Then after a short while, if you like, the concern and the interest dwindles, but the investment doesn't follow these discussions. So we have seen that as well following the West Africa Ebola outbreak. I do think this has been different because this is a pandemic that's affected all the countries. And I think for the first time, quite a large number of countries have had to take measures, and now coming back to Africa, that have had and will have a profound negative impact on their economies. So the impact will be way beyond some people dying, which is already bad enough. But I think we are yet to see the unfolding of the economic impact of this pandemic and some of the actions that needed to follow it. So I'm really hopeful, and I do think that when heads of state and ministers of finance and others who are decision makers at a level which is above the Ministry of Health, when they are looking at what resources to mobilize, what to invest in the country, they'll recognize now public health as a core, if you like, value as part of your economic development and your path to prosperity, because you can get knocked for six so severely and so quickly if you're not progressively investing in this. So I'm hoping very much that investment in resilient health systems, which will be able to deal with multiple health problems, and within that, in the capacities, the preparedness and ability to identify and control and put a stop to disease outbreaks will really be prioritized differently.
Could I ask you, I think we've got about 10 minutes left on this. Could I ask you firstly about the public health interventions you think that have proved most effective? I guess testing is one of those, and I know maybe you could say something about the collaboration you're involved with the CDC on ramping up testing across Africa, but also the possibility of treatments and what treatments might be best, or what treatments have proved best so far in fighting the pandemic.
Yeah. Yes, I mean, I think public health interventions, first, the testing is fundamental. Then it's the only way you can know if the virus is there and where it is. And here the countries work very, very hard to establish their testing capacity. As you might have heard me say in the past, it was only in 2 countries at the beginning of the epidemic. Now all the countries have this testing capacity, and quite a few are now expanding it beyond the capital city to get out into the districts to be able to detect things and turn this around quickly. And we worked very closely with the Africa CDC on this, on carrying out training, on procuring the supplies, so both the equipment and the test kits that are needed for this. So this is something that expanded very, very quickly. And then secondly, the countries, based on already existing capacities that had been built up, as I was saying, partly in response to the Ebola outbreaks, both the previous one and the one that just ended in the DRC now. So things like point of entry screening had been established. That proved to be extremely useful in identifying cases and their contacts. And then, very importantly, the work of contact tracing, isolating the cases, quarantining people. So countries did that relatively quickly. it still needs expanding in order to be able to now manage the spikes that might happen with the release of the lockdowns. And then secondly, these, if you like, more social public measures, the so-called lockdowns, stopping people moving, actually we think also had a significant impact. And here, this was at great cost. First, the economic impact that I was talking about, and then secondly, the impact on people, individuals. So it is these measures that have made a difference. The case management, so, and then thirdly, just also informing people, communicating with people, helping them with their hand washing, or at least providing, in some cases, public hand washing facilities. In other countries, there was support in reducing the cost of soap, distributing sanitizers to help people with this aspect. The case management is a challenge in African countries. I mean, countries have put in place the space, beds in some cases, temporary facilities, in others, improving their ICUs and acute care facilities to be able to take care of cases. But in most cases, we know that if we really had a huge increase in the numbers of people who fall ill due to this illness in Africa, it'll be a very difficult situation in the majority of cases of countries to have the space to manage the cases. And then, you know, the management, the treatment of patients will be a challenge. Most of our countries don't have ICUs with enough space. And to understand this illness is also a bit of a challenge in the context of your average hospital in Africa, perhaps in the exception of the central hospital in the capital city. So to be able to find out things like whether the person has got not only inflammation of the lungs, which we expect, and they're being treated, if you like, symptomatically, keeping up their hydration, ensuring that if they have a secondary bacterial infection, they are given an antibiotic. That is going on. But we've learned that there are other manifestations of this illness. For example, people get clotting, abnormal clotting, so microemboli, including in the lungs, which then would need to be detected or assumed, and people be put on an anticoagulant to stop people who are not needing a ventilator because they've got severe inflammation, but those that are having clots in their lungs, then dying of respiratory failure. So that needs to be established. And then thirdly, as you know, it's been understood now that there are some people who get a very extreme immune response to the virus and get a sort of overwhelming reaction that can shut down their system. So those are the ones that are needing to be put on a steroid, on dexamethasone, to mitigate against those impacts. So I mean, what I'm saying is that we need our clinicians to be learning about these emerging manifestations, and then the treatment protocols to be adjusted and the procurement of the medicines to be put in place so that there can be a very responsive, varied treatment. Whereas at the beginning, we simply thought, well, you know, they need a drip, they need oxygen, they need an antibiotic, and we hope they won't progress to needing a ventilator, because if they do need a ventilator, the situation in our region, as you know, is very, very difficult.
Right.
And we are interested in learning about, of course, these new drugs that are being discovered, including remdesivir, which speeds up the recovery in some of the cases, and hoping that these can be available in our countries.
That takes us to the other issue. I mean, in terms of the rules or proprietary rules, intellectual property rules on drugs, and indeed a future vaccine. I mean, has the WHO managed, and the UN system as a whole, managed to get the sort of agreements it wants, that these vital drugs, you mentioned remdesivir, and I was thinking also of dexamethasone as well, whether you've got the guarantees you need for the generic production of these drugs and distribution at an affordable cost for countries in Africa?